Anybody have a guess at who's at risk for hearing loss? Seniors, I like that, okay. Anybody else have a guess? Men? Yeah, we're more at risk, yes.
Because of the loud sound.
Oh, teenagers, it's unbelievable. My wife just started a job at Jefferson Parish. She's a speech therapist, and she was talking with their audiology department. And they actually found that they're seeing hearing loss in younger and younger ages that as they're testing the students, attributed a lot to the headphones. The kind of cheating answer, I'm sorry, is a trick question. Everyone is at risk for hearing loss. So as we age, we typically lose our hearing due to age-related changes in our hearing. I'm sorry, I know people go to doctors and they say, well, what's wrong with me? Well, you're getting older. It's kind of a cop-out answer. Nobody really likes that. But unfortunately, that is one of the bigger causes of hearing loss, is just as we age, our hearing gets worse. The system just doesn't work as well as it did. Looking at some statistics, 34 or 40 million Americans that they estimate, I've heard around 35 million is a safe number, of Americans have some type of hearing loss. 35 million Americans have some type of hearing loss. That's a big number to me. 50 million Americans have had tinnitus, and tinnitus is that ringing or buzzing sound that may be there, but no one else hears it, just a little fun sound for you. That's around 50 million. That's you? Okay. I'm sorry. Some fun statistics that y'all can throw around at the dinner table. 30% of people over the age of 60 have hearing loss. 30%. 1 out of 3 of your friends sitting next to you, I'm imagining most of you are over the age of 60. I mean 20. 20. You started counting backwards sometime, I'm sure. And then 60% of people that are 75 or older. So 6 out of 10 people that are 75 or over are going to have some type of measurable hearing loss. So this is why it's very important to encourage people that are in their 5th and 6th decades to begin to get hearing tested. Doesn't mean that you need a hearing aid just because you have a hearing test. But it's great to establish a baseline to understand where your hearing levels are and what's going on. I mentioned a little bit about the most typical type of hearing loss is sensory neural. There's actually different types of hearing losses. One, you can have normal hearing. That's the most fun to have. The other is sensory neural, which is a loss of sensitivity in the cochlea or the nerve. Another one is called conductive hearing loss. So a conductive hearing loss, the easiest way to describe that is, does anybody have grandkids? Okay. My 2 boys both have had ear infections. Okay. So an ear infection is when fluid builds up behind the eardrum, and doctors usually prescribe medications. If that doesn't work, they may recommend a surgery. And they put the tubes in. And that allows pressure to be equalized and the air to get in there, and it can clear the infection. Conductive hearing loss is related to that. The sound can't be conducted into the ear properly. So there's a problem with the eardrum, or there's fluid behind it that's not allowing it to move correctly. Or there's a break or disconnection in those bones. You can actually get osteoarthritis in the bones of your hearing. It's called otosclerosis. And that's actually, interestingly enough, a very hereditary disease. So you'll see it in families a lot, and it's more prevalent, unfortunately, in women. I'm sorry. Osteoarthritis in the ear. And they actually do have some surgeries for those things. So medically correctable hearing loss is conductive. Something is blocking that sound, so medically they may be able to go in and remove that conduction problem, and then your hearing goes back to the way it should be. They also have a last type that's called mixed, where you have a combination of a conduction problem and a sensory neural problem. So theoretically, they could go in medically and correct the conductive component, but it cannot be corrected. It is a permanent loss once you have a sensory neural hearing loss. Yes, sir. So a little bit about hearing loss in our bodies, okay? So we learned in the beginning part of the presentation that the cochlear sensory organ is connected to the brain. So if there's a problem with your ears not sending the sound up, you got a brain problem, okay? It may look like an ear problem, but you got a brain problem. And they've actually proven this because a lot of research has been done the last 8 to 10 years. A lot of it very heavily coming out of Johns Hopkins Hospital University up in the Northeast. And they found that there is a type of connection between dementia and hearing loss. Now, let me say this. If you have hearing loss, that does not mean you get dementia. Okay? If you have hearing loss, you do not have dementia. Okay, that's very important. I have seen quite a few marketing pieces that have kind of not quite made that distinction well enough, in my opinion, and used it almost as a scare tactic. Okay? Just because you have a hearing loss does not mean, oh no, I have dementia. Okay? And so the studies have found that as your hearing moves from normal to mild, moderate, severe, or profound hearing loss, what is happening is your brain is getting less and less stimulation and less information. It puts you at about a 24% greater risk of developing dementia than somebody that has normal hearing. Okay, so that's a very important distinction. Hearing loss does not mean you have dementia, but it does absolutely put you at a much, much more significant risk of developing dementia than somebody that may have normal hearing. So this is also very important. They are starting to do some research and studies in if I get hearing aids. So let's say I have a hearing loss, I find out about it, and I get hearing aids. Will that reduce my risk of the dementia? And they, to my knowledge, they have not released any studies that say definitively hearing aids reduce that risk, but they are finding that when you do use hearing aids, you are more connected to your family, you're more connected to your friends, socially you're more active, and they feel like that is going to be a contributing factor in potentially reducing that risk. But there's not a study that I'm aware of yet that says if you get hearing aids because of a hearing loss, it eliminates that risk of dementia. So, what happens to the brain when you have hearing loss? This is an interesting slide. I found this very interesting when I was reading this study. So they took some brain scans of people's brains, and the one on, let's see, y'all's left. On the left side of the screen here, this is somebody hearing speech sounds when they have normal hearing. Okay, you see like all the little centers of the brain are kind of lit up nice and orange and red. Okay. On the left side, or the other side, this is a brain with hearing loss. Okay. So what's happening is that brain is not getting near the same stimulation, near the same amount of information that a normal hearing brain is getting. And that's the problem with hearing loss, is your brain does not get that information. So that's why they're thinking there's this connection with dementia, because the brain's not getting stimulation. It's not getting activated the way it should.
You don't use it, you lose it.
Yeah, that's right. You don't use it, you lose it. That's a great, that can definitely potentially apply. Some other areas where hearing loss is connected. Is a fall a big deal? If you fell down, is that a big deal? Yeah. That usually ends up being a hospital stay in some cases, or surgery, or sometimes leads to other more complicated problems. Your risk of fall is 3 times greater if you have a hearing loss than if you do not. So if you've got a hearing loss, you're 3 times greater risk of falling than somebody that doesn't have the hearing loss. That's huge. Somebody that has Parkinson's disease. If you have Parkinson's disease, there's been some studies that have shown maybe up to 3 times more likely of getting hearing loss, where there's some type of link between the Parkinson's and hearing loss. So if there's somebody in here, or a friend or a family member that you know that has Parkinson's disease, it's highly important that they would get a hearing exam, just so that they can begin to monitor their hearing, because they are at a greater risk of developing hearing loss. Somebody with diabetes. This is between like Louisiana, Alabama, and Mississippi. They're like the capitals of diabetes in the country. Not something to be proud of necessarily. But diabetes, you're at about 2.5 times more likely to develop hearing loss because of diabetes. Okay. Heart disease, cardiovascular disease, somebody that's had a stroke or a heart attack, it would be really impressive for them to get a hearing test, just to begin to monitor that. I actually was reading a study that came out a few years ago that they were actually seeing, before the patient was presenting problems that a cardiologist would need to be aware of, heart problems, they were actually seeing that there was potentially some low-frequency hearing loss that was present. So the study was looking at, should we recommend patients get some type of hearing testing, and when they have a low-frequency dip in their hearing, recommend that they go see a cardiologist to begin to monitor for potential heart conditions. So your hearing loss or hearing testing can play a huge role in your overall health. And then people with kidney disease. This was something very interesting to me. So diabetes and kidney disease are often kind of linked together. But what happens is with diabetes is it affects the way the blood vessels are working. Okay, and smaller blood vessels can begin to deteriorate and not work as well due to the complications with insulin absorption. So with diabetes, the same things you'll see. You'll see people that have vision problems because the eyes and the ears actually have very similar sized blood vessels that go to keep them active and working. So if you have a problem with your eyes and you're a diabetic, you may also begin to develop problems with your ears.